Hey everyone! Welcome back to Park and Post. Today, I want to talk about how to avoid deep vein thrombosis on a long flight. Deep vein thrombosis, DVT, is a medical condition in which blood clots form in deep veins, usually in the legs. It is a potentially serious condition that can lead to pulmonary embolism, a blockage in the lungs that can be fatal. DVT is often associated with prolonged immobility, such as sitting for extended periods of time during long flights. The causes of DVT during long flights are multifactorial, but the main factors are prolonged immobility, dehydration, and decreased atmospheric pressure in the airplane cabin. When sitting for long periods of time, blood flow slows down, increasing the risk of blood clots.
Dehydration can make the blood thicker, increasing the likelihood of clot formation.
The low air pressure in the cabin also reduces the amount of oxygen in the blood, making it more prone to clotting. Although I do not have personal experience of having DVT during all my flights, however, I can provide general advice on how to avoid DVT on long flights based on guidelines from healthcare professionals. These are some of the tips. Choose comfortable clothing. Wearing comfortable clothing is important to prevent constricting blood flow and putting unnecessary pressure on your legs. Loose, fitting clothing is ideal for a long flight. For example, wear loose pants or leggings instead of tight jeans or skinny pants. You can also opt for compression socks or stockings that can provide additional support for your legs and improve circulation. Stay active before the flight. Regular exercise and physical activity can help improve circulation and reduce the risk of DVT. Some examples of exercises to do before a flight include jogging, walking, cycling, or swimming. If you are unable to do these activities, you can try simple leg exercises such as ankle circles, leg lifts, or calf stretches. These exercises can help increase blood flow and reduce the risk of DVT. Consider seat location. Choosing the right seat on the airplane can make a difference in preventing DVT. Opt for a seat with extra legroom or an exit row that can give you more space to stretch your legs.
An aisle seat can also be a good option, as it allows you to get up and move around more easily.
Pack wisely. Bring essential items with you to help you stay comfortable and hydrated during the flight.
For example, bring a refillable water bottle to keep you hydrated throughout the flight.
You can also bring a neck pillow to support your neck and head, and an eye mask or earplugs to block out noise and light. Take breaks. During the flight, make sure to take breaks and move around whenever possible. Try to get up and walk around the cabin at least once every hour. If getting up is not possible, you can do some simple leg exercises while sitting, such as ankle rolls, foot pumps, or leg lifts. These exercises can help improve blood flow and reduce the risk of DVT. Know the risk factors. Some people are at higher risk of developing DVT than others. Risk factors include a personal or family history of blood clots, pregnancy, obesity, smoking, and certain medical conditions, such as cancer or heart disease. If you have any of these risk factors, it is important to talk to your doctor before flying. Before we proceed further, if you found this video helpful, please consider subscribing to our channel. You need to know the signs and symptoms of DVT. Symptoms of DVT include pain, swelling, redness, warmth, and tenderness in the affected area, usually in one leg. In some cases, there may be no symptoms at all. It is important to be aware of these signs and seek medical attention immediately if you experience any of them. Know when to seek medical attention. If you experience symptoms of DVT during or after a flight, seek medical attention immediately. Treatment for DVT typically involves anticoagulant medications to prevent the blood clot from getting larger and prevent new clots from forming. In severe cases, surgery may be necessary to remove the clot. Know how to prevent DVT on future flights. If you have had DVT in the past or are at high risk, talk to your doctor about how to prevent DVT on future flights. In some cases, your doctor may recommend taking blood thinners before or during the flight, or wearing compression stockings to improve circulation. In terms of personal experience, when I fly on an airplane, I always make sure to follow these guidelines. I wear comfortable clothing and compression stockings, and I try to stay active before and during the flight. I also bring a refillable water bottle and a neck pillow to help me stay comfortable and hydrated. During the flight, I make sure to take breaks and walk around the cabin whenever possible. If I am unable to get up and move around, I perform ankle and foot exercises while sitting to improve circulation. It is also important to be aware of the symptoms of DVT, such as swelling, pain, warmth, or redness in the affected leg. If you experience these symptoms during or after a long flight, seek medical attention immediately. In summary, by taking proactive steps to prevent DVT before, during, and after a long flight, you can reduce your risk and enjoy a safe and comfortable travel experience. Watch the upcoming video and click the link below to get your exclusive discount on your next flight.